This is Josh. I'm a pharmacist with pharmacisttips.com. I'm going to talk to you about the medication fluoxetine. We're going to cover some of the uses, the dosage, as well as the side effects associated with this popular medication. The specific topics we'll cover in this video include what specifically is fluoxetine, the uses for fluoxetine, common dosages, the most common side effects with this medication. We'll talk about its effect on weight, other side effects as well, potential drug interactions, and then we'll discuss withdrawal from the medication. First off, as with all my videos, this is informational purposes only. Always talk to your healthcare provider before making any changes to your medications or lifestyle. What is fluoxetine? It's a medicine in a class called SSRIs, or selective serotonin reuptake inhibitors. Basically, it makes more serotonin available between the nerves at the neural synapse. So that works under the theory that many forms of depression are related to a lack of serotonin. In the U.S., it's sold under the brand name Prozac, although the generic is widely used. Uses. Fluoxetine's been around a long time, and there are a lot of uses for it, including depression, bulimia, OCD, obsessive compulsive disorder, panic disorder, premenstrual dysphoric disorder, binge eating, body dysmorphic disorder, fibromyalgia, anxiety, PTSD, premature ejaculation, social anxieties, and there are many other conditions as well. Those are the most common. So the dosage, it's available in the U.S. in tablets and capsules in typically the 10, 20, or 40 milligram dosage. Usually we see that start around 20 milligrams a day for most adults. Now, the max dose is 80 milligrams a day. Rarely do people exceed 40 milligrams a day, though. Very, very rare that we see that high dose. Lower doses in those that have some poor liver function. Your doctor can watch for that. It's usually taken in the morning with or without food. A lot of people do take it first thing in the morning without food. It's going to vary. Most common side effect, see, 2 in 10 or 1 out of 5 get a headache. Insomnia can occur, and it is dose dependent. And many of these side effects improve after the longer you take the medicine. So just because these occur doesn't mean you won't be able to continue the medication. Nausea can occur up to 30% of people, again, dose dependent. Tremor, anywhere from 3 to 13%. Dry mouth, 9 to 12% of people report that occurring. Loss of appetite can occur anywhere between 4 to 17% of people. About weight loss or weight gain. Weight loss is more likely. A modest weight loss is reported in about 2% of people who take the medication. As the SSRIs don't seem to have a lot of weight gain. Paroxetine seems the most likely to cause weight gain. Fluoxetine generally not known for causing large weight gain or weight loss for that matter. Weight gain is reported in less than 1%, so weight loss is more likely with this medication. Other side effects that can occur, we're talking less than 10% of people, so 1 in 10 or less. Anxiety, weakness, low energy, bleeding, excessive sweating, sexual dysfunction, rash or itchiness, stomach upset, constipation, cold or flu-like symptoms, rash, weight change, chest pain, increase in blood pressure, dizziness, change in dreams, chills, visual changes, ringing in the ears. And of course, so if any of those are occurring, of course, you'd want to contact a healthcare provider, see if that's something that you should continue, because a lot of times side effects do improve the longer you're taking a medication, but if it's inhibiting your life or bothersome, be sure you contact your healthcare provider. Other warnings and rare side effects include suicidal thinking. That's a warning on all antidepressants that it can occur. It's extremely rare, but if that does occur, you need to get professional help right away. Serotonin syndrome, again, really rare, where you can get immediate changes in how you feel. Your muscles can change. You can start sweating. It's something that requires immediate medical attention. Bleeding risk, we'll talk about that just a little bit more coming up. Heart rhythm changes, not very common, but it can occur. If that does occur, you want to be sure that you seek um, your healthcare provider's advice. Seizures, more common in people who've had seizures before or people who have abused alcohol. That does put one at higher risk of seizures. And low sodium, again, really rare. So drug interactions, the two biggest ones I'm going to talk about: increased risk of bleeding. So um, antiplatelet drugs, warfarin, people who are put on medications to um, quote unquote thin their blood or to prevent blood clots. Um, the fluoxetine can also increase the risk of bleeding. So using the two together can increase the risk of bleeding even more. And that it also includes NSAIDs. That would be like ibuprofen, naproxen, Aleve, meloxicam. Now, we do see these used together, so you can use them together with your provider's approval. However, you have to be aware it increases the risk of bleeding. So it's not an absolute that you can't use them together, but you need to be cautious. You need to watch for signs of bleeding, and just check in with your healthcare provider time to time so they can monitor. Serotonin syndrome we touched on briefly. That's where you have the abrupt change. You feel just terrible, and you would want to seek medical attention right away. Triptans are used to treat headaches. Dextroamphetamine, that is used to treat ADHD, attention disorder. Tramadol for pain. Tricyclic antidepressants like amitriptyline, nortriptyline. Now again, it's not an absolute contraindication. These are sometimes used together. You just have to be aware if you're using these along with fluoxetine, it does put one at higher risk of problems or interactions. And if that does occur, you want to seek medical attention. Withdrawal. So stopping this medication, most people do best tapering it usually over 1 to 4 weeks. If you've been on it years, sometimes you even need to drag that out a little further. It does have a long half-life in the body, and some people are able just to stop, quit cold turkey. However, in my experience, most people, after a week or so, they're like, I just don't feel right. I think I need a lower dose for a while. So most people seem to do better tapering off this medication slowly. Again, that's a conversation you can have with your healthcare provider. All right, I thank you for watching. Please like this video if you like this kind of information. Subscribe to my channel, and go ahead and ask any questions in the comments below. Thank you.